Hey guys, Coach Daniel here at CrossFit Mainline today. We're here with Dr. Stu. He's in the house. He comes in a couple days a week, so check his calendar online. We also post it on Facebook and on the blog. We're here with Coach Steph today, one of our CrossFit Kids coaches. She's had some issues with her back in the past, not due to CrossFit. That's important to say, right?
Yes.
Okay, she ran a lot before she came in here. Today we did a 1 rep max of a clean and jerk. And one thing Dr. Stu does as a chiropractor is he really works with athletes to use chiropractic care as recovery. So he's going to treat Stephanie today, and he's going to talk to us a little bit about why it's important to do what he does on athletes as they reach 1 rep max weights.
Okay. Well, as Daniel said, we did do a max clean today. And in chiropractic, we always say structure dictates function. And that's why form is so important. And that's why, you know, when you go to CrossFit gym, we get like here, and there's also affiliates of CrossFit have proper coach training. But sometimes when you do a maximum lifts, you can put excessive stress and strain on the spine. And with the compressive loads of the spine, could put pressure on the facet joints, with the joints below the back, which are very nerve-rich and cause a lot of irritation, discomfort when compressed. So as we discussed with Stephanie, she was doing a clean, and one time with her max, she hyperextended as she came up, as she tried to do extra weight. So that tweaked her low back, and we've been working on it already. It's been doing much better, but just tweaked a little bit today. So as a chiropractor, I work on the alignment of the spine by taking pressure off the spine, take pressure off the discs, the joints, and the nerve roots themselves can be irritated. And when we have the spine in proper alignment, it gives the body a better ability to heal itself appropriately. And one of the things I love in Kelly Starrett's book is Becoming a Stalker Leopard. In the beginning of the book, he says the body has an amazing ability to heal itself. And that goes along with the chiropractic premise. As long as everything's functioning properly, the body should heal and function properly. So I'm going to take care of Stephanie now. I'm going to have her lay down. I'm going to work with the alignment of her spine. So again, as a chiropractor, all chiropractors have some different analysis on where to adjust. And Stephanie's tender here.
Yeah.
So Stephanie irritated her joint back here, the lower back joints called facet joints. And also, in the past, she had some disc issues, which can get inflamed as well. So as a chiropractor, we want to take pressure off those joints. So I'm going to do, as far as I'm watching, what I'm going to do for Stephanie first is manually I'm going to distract the low joints in her back with pushing in different directions on her lower back. You okay with that? And some of us refer to this as pumping the disc. We're trying to take pressure. Since she compressed it, we're trying to decompress the joints. I also use an instrument, sometimes additional hand. This one's called an arthrostim, the different instruments. Now with this, I can lightly tap on the joints. In this case, it comes up.
Is she broken? Did we break her?
Excuse me. Our lower back is feeling the most of it. Mid-spine takes some of the stress as well. So I think it's deep breath in step. All the way out. Release that. Relax. Yeah. Now, although it may seem forceful, it's not as much as it looks.
So every time after you adjust her, you're taking a look at her feet. What's going on there?
Correct. Again, as I mentioned earlier, there are different types of analysis, but one of the things chiropractors do is called leg length inequality. If there's tension in her pelvis, it's going to cause the musculature to tighten more on one side than the other. That's going to cause the muscles to creep short on one side, which gives it an appearance of one leg being longer than the other, which is different than a functional short leg, and which means one leg is literally anatomically longer than the other, which is a rarity. And if it is, sometimes we put heel insert foot lifts, and sometimes you need to shoot with a little bit of lift in it as well. And then after the adjustment, if we take the pressure off the nerves, these will balance out. So Steph, I'm going to have you lay on your side facing this way. And this position is called side posture position. Lightly, roll step easily. Breathe the breath in. Go out. Just lay back. And sometimes you may hear the joint realign. Sometimes you do, sometimes you don't. Usually you do. And then with someone like Stephanie, what I'll do also is sometimes we do some stretching. I do a little PNF stretching, stands for proprioceptive neuromuscular facilitation, which just by stretching. Now Stephanie, I'm going to be pushing to my shoulder. Push, push, push. Now relax. And then it allows me to stretch a little further. Now push one more time, lightly. And then relax. Again, let's go even further. Push one more time. Relax. By contracting the muscle, it allows it to relax and facilitates it, allows it to further stretch. And feel stretch here?
Yeah.
So we're stretching out the piriformis muscle, which is the muscle which is in the buttocks, quite often involved with sciatic problems when people are reading, pain down their legs. Also quite common with pregnant patients. And we have some pregnant patients here across the main line. It seems to be a lot lately.
The winter storms of last year.
Yes.
I think we had at the latest count we have 9. 9.
Push my shoulder. Relax. This all started before the chiropractor.
That's right.
Push my shoulder. Relax. Nice stuff. Now relax here. Go stretch your buttocks.
Yeah.
Nice. Good. Relax. Okay, step. Now, the proper way to sit up is going to be roll over your side, like you're sleeping. And then use your elbow and your hand, bring your legs over the table, push up. It only takes a couple minutes to perform an adjustment, and hopefully we're on video checking Stephanie. She should feel a little better. The patient, in the case I always recommend put ice on it, 15-20 minutes every 2 hours to calm down the inflammation. Ice is Mother Nature's anti-inflammatory. Drink plenty of water. Can't stress enough the importance of hydration. General rule of thumb is half your body weight in ounces every single day. So an athlete's about 200 pounds. You should drink about 100 ounces of water a day, and do it accordingly. Most people are chronically dehydrated, which also contributes to injuries because the muscles need to be moist. If they're dry, they're going to have a tendency to irritate and stress you. So hopefully Stephanie will feel better after this, and we'll check up on everything else.
So guys,
Thank you.
so guys, if you have any questions for Dr. Stu, you can catch him here at CrossFit Main Line during his office hours. Usually works out early in the morning, 6 a.m. or 9:30. You can catch him then there. And we're going to eventually have him over at R5, set him up over there too. Check out Facebook for the latest videos with Dr. Stu and Chiropractic Care for Recovery. Thanks.
Thanks.
Thanks, Dr. Stu.
You're welcome.